It is a huge honor for me today to be interviewing Nareg Apelian, who is not only a dentist in Montreal, but dude, you have 6,300 posts. You've been a townie since 2007. I feel like I know you like a brother, but I only know you on text, and I think so many townies are going to just love meeting the human behind all those amazing posts that you've been posting since 2007. Thank you so much for sharing so much information on Dental Town.
Thank you. The honor's all mine.
And now you're sharing information in the dental school. You're working in dental school. So was that like just wanting to give back like you do on Dental Town, or what made you get interested in a dental school?
It started a couple of years ago. I decided I wanted to do a master's, and then I started to do the master's, and it turned out I enjoyed the environment here at school. So I figured, you know what, I want to spend more time here. So when some positions opened up, I applied for them, and next thing I know, I'm 4 days a week now at McGill University. That's in Montreal. Yeah.
4 days a week teaching.
4 days a week. Yeah.
Teaching what?
I do two things. I'm the director of the continuing education program here, and I teach everything clinical to the third-year students. So every time the third-year students are in the clinic doing anything, it's under my course.
Wow. And I have one of my friends is a very successful dentist, and he decided he didn't work Fridays, so he decided a couple of years ago that he was going to go back to dental school and just teach on Friday. And when you talk to the guy, he almost never talks about his 4-day work week. He's always talking about exciting stories in the dental school. I know he just loves that 1 day a week more than the other 4.
I think as dentists, we're so alone in our offices, and in the dental school, we're so surrounded by students and our teachers and people we get along with and everything. So the environment is really nice. So it's very satisfying from that point of view to work in a dental school, at least for me. Like, I know some people have horrible experiences at dental schools, but I seem to be enjoying it. Mind you, I'm new. It's only been like a year and a little bit, so maybe that's why I'm so excited. I don't know.
So you teach clinical for third-year students.
Yeah.
And that's at McGill University in Montreal, Canada?
Yeah.
So then you're bilingual. You speak French and English?
Correct.
Correct. Is that the only 2 languages?
And Armenian.
And Armenian. So you speak 3 languages.
I speak 3 languages.
That's amazing. I can barely do English. I don't know how you guys can do 3 languages. So you teach clinical, but what's the other part that you teach?
I teach clinical. The other part is an administrative position. It's the continuing education. So I run their program, basically. So I put together events. I contact speakers. I book the speakers. We negotiate the fees, all that stuff. Come up with a program. That's what I do.
Well, seriously, for your 6,310 posts since 2007, if you ever want me to speak, I'll waive my honor and I'll do it for free. Just for my bald buddy on Dental Town. I will. I mean that sincerely.
It's recorded. Everyone heard it.
I know. I'm dead serious, dude. I mean, how many hours do you think it took you to post 6,310 times on Dental Town?
A while ago, I calculated how much time I was spending on Dental Town, and it was close to, I don't know, it was in the thousands, I think, per year.
Yeah.
So
for me to give
education points,
So for me to give 1 day back to you, that would be the smallest return gift on. That'd be like giving you a chocolate mint after you fed me Thanksgiving dinner. So tell me what this is my beef with dentists whining about dental school. Dentists always say, they should, in dental school, they didn't teach them this or this or this. And I'm like, dude, I'm in dental schools a lot. You're taking 100 kids off the street and 4 years later, giving them a license to do whatever they want. I said, they're completely overwhelmed, and you just can't teach. And these dentists always forget that they've been out of school 10, 20, 30, 40 years. And I just don't think they can remember going back to what it's like to walk in. I can remember one of the first root canal lectures in dental school, and my roommate says to me, he goes, what is endo? And I'm like, dude, your dad's a dentist. How do you not know what a root canal? So people just assume, well, your dad's a dentist, you know how to do a root canal. No, there were kids in our class that didn't even know what a root canal was, and their dad was a dentist. So what is it? What are the challenges of teaching kids in 4 years from A to Z?
That's exactly what it is. I mean, I'm doing the third years. The third years are their first experience in the clinic. And a lot of my instructors, they forget, like you said, that, they've never done a freezing before. We call freezing, it's the anesthesia. So they've never numbed. Is that what you guys call it?
Yeah, and
So they've never,
you guys call septicane articaine, don't you?
well, yeah.
And Septicane is a French company. They started in Paris, France, then they went to French Montreal, Quebec, right?
No, in Paris, France, I don't think Septicane markets as Septicane here. I think it's marketed as Articaine.
Yeah, but
Articane's been around forever. Articaine is the real name of the chemical.
yeah, but when they went to North America, they went to Montreal, didn't they?
Oh, possibly. I don't know.
Yeah, I remember that.
I don't know. So even those kids haven't even done anesthesia on patients, let alone all those complicated concepts. So it's hard for the instructors just to step back a little bit and say, okay, one step at a time, we're going to hold your hand and you're going to be okay. So there's a lot of human teaching, give them the confidence so that they can go ahead with it and not worry too much about the dentistry at this point, get them used to going from their simulated plastic teeth to real people, how that changes things. So those are mostly the challenging parts. Because dentistry, I mean, we're all comfortable doing dentistry, but then transferring that information to students gets a little bit more tricky.
I can still remember my first freezing, as you call it, with it wasn't Articaine. They didn't even invent Articaine back then. That would have been 1984 as a freshman, so it would have been 85, 86. And obviously, I was way too high. I mean, I was so high, I was out of sight because the person started getting, their eye was getting numb, and they started getting blurry vision. And my lab partner, I'm going to throw her under a bus right now. I hope this never gets back to her. It was Dee Dee Richards, and she's like, starts praying like, oh my God, his eye, what's wrong with his eye? And I was like, I'm like, okay, I'm too high. Everybody just settle down and relax. This will wear off in 2 hours. And an instructor came and everything. So yeah. So, and then these dentists are complaining that they got out of school. They never did veneers and ortho, and they never placed an implant and blah, blah, blah. And the list goes on and on and on. It's like, dude, relax. They got to get out and do, a filling, a cleaning, an X-ray, a crown.
Yeah.
So are you doing continuing education for students, or are you doing it for alumni too?
Alumni.
Yeah. Okay.
Yeah, like dentists.
And not to ask a dumb question.
The Hogo of Dental Town. I'm the Hogo of McGill, basically.
You're the Hogo of McGill.
Yeah.
And your course, and I'm sorry to be ignorant, but most of your courses in Montreal, do you have them in French, or do you have them in English, or do you have them both?
We have them in English because we're an English school. We have one course in French. We're starting to dabble in that. But there's a French university here also. It's the Universite de Montreal. So they do the French courses. We do the English courses because we're the English university. They're the French university. And there's two universities in Montreal that does
two dental schools.
Yeah, two dental schools.
Two dental schools in Montreal, or two dental schools for all of Quebec?
No, three dental schools in Quebec. There's another one in Quebec City called Université Laval, but in Montreal itself, we have two dental schools. We have UDM, which is big school. I think they have 80, 90 students. We have 35 to 40 students. We're a much smaller class dental school. But we're considered one of the top schools in Canada. It's a decent school, Miguel.
So do you miss private practice?
I'm still doing private practice once a week. And I'm also doing the faculty practice here at the university. So yeah, no, I would definitely miss it. I think it's part of my identity. I can't just get rid of that. I would feel empty.
Right.
I just couldn't do it every day because it was starting to get boring. I guess I reached a point in my practice where I needed more challenge or maybe more people. I'm not sure exactly what it was. But
I think I know what it was. You're a natural sharer. You're just a natural sharer. If you learn something, you get excited and you like to share. I mean, I've followed 6,000 of your posts. You learn something, you just naturally want to share it with your friends and colleagues.
Possible.
Yeah.
Possible.
So you always talk about patient-centered care, and my beef with dentists is that if you ask a dentist with a straight face, you say, do you think you're focused on the patient? Or do you think you're focused on the dentist? Do you think it's all about you or the patient? And they'll say, oh, it's all about the patient. I'm like, okay, what are your hours? Monday through Thursday, 8 to 5. I mean, they really believe they're focused on the patient. Then you go through a checklist of 20 things and they maybe click off 3 things. I mean, they're just not patient-centered. So talk to me about talk to everyone. You're talking to about 7,000 dentists, and probably almost all of them are townies that are big. If they missed if they missed your post, they must not have turned on the right website. What does patient-centered care mean to you?
Patient-centered care is one of those terms that's hard to define because it's understood differently by different people. So if you're a surgeon, you might understand it differently. If you're a dentist, you might understand it differently. If you're a dentist that's doing aesthetics, you might understand it differently. So there's no universal definition for it. The closest I can come to it is doing care that takes into account the patient's views, feelings, and if there's one word I can stick to, it would be more healing instead of curing. So it's all about this concept of we need to heal the person. How do we heal the person? Well, we can't just look at the disease part of it because dentistry is very good at just looking at disease. We're like disease, disease, disease. And then we don't look at what does the patient really want. Maybe the patient wants something else that's not diseased or diseased but wants to fix it in a different way. And it's a patient-centered care is a way to integrate that into the treatments basically.
And whenever you say those types of words, feelings, healing, things like that, a lot of patients are thinking. I hear patients a lot. I had a person ask me in the swim pool this morning. Well, do you do any like holistic dentistry or alternative dentistry? What do you think the consumer's thinking when they hear terms? Because I know dentists on Dental Town, if they hear the word holistic, probably 98% are like, oh, brother,
Yeah, exactly.
they think, okay, there went the science and the math and the gravity, and now it's all feelings. But consumers, what do you think consumers are thinking when they hear holistic or alternatives?
I think the consumers are attracted to holistic anything, medicine or dentistry, because of the human aspect. It's not because of the treatments they're doing, in my opinion at least, but the fact that those holistic practitioners spend more time, they speak to the people, they listen to the people, they really get the people, they connect well with the people. The fact that they do that, the people get attracted to that because there's value to that. There's healing value to that, to connect to the people. And since the other side, the more traditional medicine or dentistry, if you want to call it, we've kind of forgotten that aspect of it. So it's become two camps, the holistic dentists who do those, touchy-feely, hug trees type of thing, and then the other dentist or medicine who does not do this. So it's become like two camps. However, things are changing now, and we want to incorporate all that listening and bringing the patient back, the human side of it, into dentistry. And I think as medicine goes into that direction, the whole alternative, non-alternative thing might not be an issue anymore, I think. The whole holistic dentistry would not exist if we do the interesting part of holistic dentistry integrated into regular dentistry.
But you know what the physicians and the dentists don't want to hear? They don't want to hear the reality is that, when you're listening to people on the street that you live with and work with and shop with and everything, they have really lost faith in the medical model of you go in there, you're sick, and they either surgically cut something off or they give you a lotion, potion, pharmaceutical pill. And the pills all have side effects, and they all know people that have started taking a pill, and the next thing you know, they have leaky bladder, they had other symptoms or side effects. And they're starting to look at physicians, well, if you just go there, he's just going to cut something off and give you a pill. And I don't want to start I don't want to go to the pharmacy every week and be on some medication the rest of my life. And the truth of the matter is, would you rather cure your blood pressure through diet and exercise or a pill? Would you rather lower your cholesterol through diet and exercise or a pill? I think the pharmaceutical people are they are losing ground, and I think the holistic people, and I think you described it well. They're better people. They're better listeners. I've been saying that I think the average dentist could double their income if they got a part-time weekend job as a bartender or a waiter, just to learn how to just be with people and just talk with people.
That bartender is doing a lot of healing behind his, yes, there's the booze, but there's also the whole listening part. And this is not like invented. This is well established, written, studied in medicine. This dates back to the 70s where they said, you know what? They came up with the concept of the doctor as a drug. So the doctor who listens is the treatment. That has therapeutic value, and for whatever reason, it's been lost throughout the years. Like we haven't latched onto this, but it's changing.
I love that. The doctor is the drug. Wow, that is profound. I mean, you don't get a drug at a pharmacist. You get a drug by talking to your doctor.
Yeah.
And
Yeah.
and it's just so amazing how these dentists are technicians, and they think that the only way to be successful is to get a laser and a CAD cam and digital radiography. And it's like, dude, the people doing the most amazing practices, they nail the fluffy, touchy feely talking, chemistry, listening. They
Hmm.
nail the people. And once you get
Yeah.
that relationship with people, they don't care if you have digital x-rays or film. They don't care if you have a CAD cam or a lab, man. They don't care about any of that crap.
Yeah.
They
It's
just
all about
want
relationships. You
yeah.
have to connect at a human level. It's humanizing. And the moment you dehumanize, I think that's when we start getting problems. And it's not the dentist's fault. I don't think it's the dentist's fault. I think it's the university's fault. I think it's the teaching. We teach very axed on anything biomedical. It has to have a disease component to it. And when it has a human component, we get scared in dental schools and we go, no, 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 we don't want to touch this. This is humanities. We don't do humanities. We've been urging the universities to integrate humanities into the dental curriculum because it's important. We're dealing with people. We need to understand people. In order to understand people, we need to delve into the humanities. And it's a hard sell because there's years and years and years of tradition of looking only at diseases and not looking into the human aspect of things.
Okay, explain what humanities is and what are courses in humanities, and talk about that.
Humanities could be anywhere from art interpretation, anthropology, sociology, anything that deals with learning about how to be with people. And the art departments are doing a very good job creating subtleties. You when you interpret art, I mean, there's no one right answer. There's many different answers. It brings people together. It shares. You listen. You tend to listen more critically. You learn all these skills that are so important in communication. Yet when we go into dentistry or medicine, we've nailed communication down into a specific science where we just like smile 3 times, shake hands, check, check, check. That's not how you communicate. Communication is more of there's more to communication than reducing it to a bunch of steps. And in the arts, they get this. And when you do interpretation, you understand this. And then you can put things in context. You create bonds, relationships. And I don't think you can do this with more of a reductionist way of teaching.
Joyce Bassett, the first woman dentist president of the American Academy of Cosmetic Dentistry.
No,
Yeah,
no.
yeah. She had a dinner party at her house last night, and she had the most amazing artist deal. It was a bunch of cigarettes shaped as a hand smoking a finger.
Oh, cool.
I thought you said art interpretation. I just saw it last night. I took a double look at that painting. I'm like, wow, that is a wild painting. But you're so right. The humanity is everything, and the problem is the dental schools and the school rankings. Like I remember when I got my MBA, they were saying the number one complaint with MBAs from the S&P 500 is that you sent me this person and has an MBA, but she doesn't work well with others. She doesn't work in a team. He doesn't get along with others. So they're trying to do all these team exercises. Like half your homework had to be a team deal. And I was sitting there thinking, no, you guys don't get it. You only accept people who make straight A's. They
Exactly.
live in libraries. They don't have lives. They don't have girlfriends. They weren't in frats or sororities. They didn't have a part-time job as a bartender. You only accept these 4.0 geeks because you want your rankings and you want to say, well, we had a smarter entrance class than this other school. So it's natural selection. You accept all of these freaks, and then and their only skill set was A's in calculus, physics, and trig. And then you turn them loose into a business like dentistry where we sell the invisible. Nobody knows what a root canal is. And these people don't have the skill set to explain what a root canal is.
It's even more than that. Those who are getting really high marks are go-getters, ambitious, really able to focus. So not only it's not the good strategy, it's the opposite strategy. But that's changing. Now, for example, just an example, as of last year or 2 years ago, to go into McGill, you do MMIs. MMIs are multiple mini interviews. So you're put into this simulated room with an actor, and there's 10 different stations. And the actor, for example, one of them could be a homeless person, and they want to see your interaction with the potential applicant's interaction with a homeless person, and then they see how it's interacting. And then there's an interview asking, why did you act this way? Or how come you acted that way? And then they want to capture their human side of it. And if they don't see the human side, no matter what your GPA is, you're cut out. So now
wow, I've never heard of anything like this. When did they start doing that?
Well, we annexed with medicine, and medicine's been doing that. So we're using the same admissions process as medicine, and medicine clued into this like a while ago. So we're just like hopping onto that bandwagon. I think it's a
Really?
great idea. It's a superb idea.
So it's 10 interviews. I mean, the student's going to meet 10 different people, and they're all actors.
Yeah, it's a room with a mirror. You know when they do interviews in movies with the police are watching from behind the one-way mirror? So that's how it is. You have 3 or 4 professors looking in, and then you have an actor inside the room, or 2 actors sometimes. Sometimes you have someone who gets angry and upset, and then they want to see the reaction of the student, potential student. And then there's a little analysis after of what did we see and what happened. And they want to check how well you perform under stress, how empathy do you have, how much can you connect with people, how charismatic you are. You know, all these things can be evaluated through those. Well, ideally could be evaluated through these multiple media interviews. They have their own issues, but I think they're a much better way of doing things than the traditional interviews.
And what part did you play, Nareg? Were you the homeless guy, or were you the the guy that lost his temper? What part did you play on this?
Terrible actor. I'm not involved in the admissions process.
Huh. Well, that's
But
great.
the
You know,
actors are real actors. Like they're acting students from acting department who get hired to. I mean, they use this for interviews, but they also use it to train medical students. So actors act out, let's say, somebody who has cerebral palsy. And then the teachers go behind the mirror, and then the students enact, let's say, an encounter with someone who has cerebral palsy. And then they come in, they say, okay, you do it this way, try doing it that way. They go back out. So it's a teaching tool also. So the simulation center is not just for admissions, but they can be used for admissions also, and they are being used for admissions.
you know what? Most of my dean friends also tell me they're looking for they're afraid of the person that's going into dentistry because they want to make $1 million. And what they're looking for, did the person do any volunteer stuff? And the secret to at least 5 deans that I know close, if they don't see volunteer work in the St. Vincent de Paul or the Cass Homeless Shelter, or or these different deals, they want to see that you just love helping people save their teeth, regardless if there's a money associated with it. Or are you?
I don't have anything against dentists wanting to make money. I think there's nothing wrong in making money. But it doesn't mean make money at the expense of the patient's health. Like, don't cause harm so that you can make money. So as long as you're doing good and you make money on the side, I have no problem with that. Like, that's fine. That's great. Yeah, and I'm convinced the dentist who's more patient-centered will make more money. It's because patients will love him. Patients love practitioners who connect at the human level. Everything goes better. They're happy. They go home. They say, wow, this guy's amazing. They tell everybody they know, you have to go to this guy, because nowadays there's so little. There's much less dentists who do this than they don't do this. So those who do it, they kind of shine among their peers.
So let's talk about the success of that. They're more patient-centered.
I guess so.
I believe they're more into continuing education. It seems like everybody I know that just rose to the top was always doing 100 hours of CE a year. Do you believe that?
I believe that. I think so.
They love to learn. They're lifelong learners. They didn't walk out of school and say, oh, I got my diploma. I graduated from McGill. They're just always in student mode. I don't care if they're 65 years old. They're still doing 100 hours a year. They're always in learning mode.
I'm not sure it's the CE itself that makes this, or it's the type of people who would pursue 100 hours of CE are the type of people who have some kind of a passion, and it's the type of people who have some kind of a passion who end up being attracting more patients, being better at their jobs. There's a whole package deal. I have trouble saying, oh yeah, because they took the CE, they're like this, but more like it's the type of people who do this are also the type of people who tend to be successful, maybe.
Man, you're a smart critical thinker. I see that with a lot of studies. So they're just so biased. I obviously I'm not a pro smoker and I'm anti-smoking and all that stuff, but a lot of the smoking data is so skewed because, well, if you're a smoker, you're more likely you don't exercise. If you're a smoker, you're more likely to drink. If you're a smoker, you're less likely to eat vegetables. I mean, so that smoking is a tag of like a whole basket of bad behavior. So you're just tagging someone who doesn't care. You know what I mean?
Yeah, totally. And dental science literature is full of these problems. full of these problems. A lot of things we know in dentistry, I mean, maybe they just go together. We don't know one causes the other. And as dentists, we're very quick to say, oh yeah, this causes that, because there's something in our brain wants to make connections. And it's hard to just step back and say, maybe there is no connection. Maybe they're just together.
Well, then that's a red flag for the evidence-based dentistry movement.
Well, the evidence-based dentistry movement started with a very good evidence-based medicine started with very good intentions. They wanted medical practitioners to be more skeptical about what they read. They wanted to teach them science methods, methodologies, and all these things so that we get better doctors. However, somewhere along the line, it turned into a guidelines thing. This is evidence-based, so it must be true. And then we kind of swayed away from this whole idea that let's be more critical to whatever we're reading. Let's be more naive when we see something, and then look at it with naive eyes, basically, and then be able to analyze it without bringing our own baggage into it. However, that's not what's going on today. Hopefully, it's going to go back to somewhere more balanced. But right now, I'm a bit scared about the idea that we do half-assed studies that are not really well designed, and then we interpret from that conclusions that are very strong, like, oh yeah, this causes that, obviously. Whereas that's not what the study said. And this goes against what evidence-based movement was about. However, that's not the reality now. So yeah. I'm a bit skeptical about the whole evidence-based. I'm all for evidence-based, but I'm skeptical about the quick conclusion, jumping to conclusions based on the evidence.
Well, I always think governments should benchmark against other governments, and governments should benchmark against other industries like private sector, nonprofit. And you look at the healthiest companies out there, and they'll spend 3 to 5% on R&D. And then you look at the American healthcare budget; they don't even spend 0.5% on research. They spend when they go spend $1.7 trillion, it's all on drilling, filling, billing, surgeries, pills. It's like, God, don't you think 5% of all that money should go into be studying about all these surgeries and pills you're handing out? I mean, wouldn't that just be a much better use of the money?
Yeah.
I mean, they just pay for every surgery and every pill, but then they don't have any money to study that stuff. It's kind of.
Howard, you should come to Canada. You should be Canadian.
I should be Canadian. I love Canada. I really do. I absolutely. I live in Phoenix, so it's a perfect winter. But the summer is. I need to figure out how I can be a Canadian in the summer and a Phoenician in the winter. By the way, I don't know if you know this about Phoenix because you're more on the east side of Canada, but they say 10% of Phoenicians are Canadians. 1 in 10.
1 in 10.
1 in 10. I mean,
winters are gorgeous.
And I've seen that number. I've lived down here since '87. I've lived down here 20. I've seen that number every 5 years or 10. Every 5 years the whole time. And it's amazing because they come from Alberta and Saskatchewan and all these places, and they just love the winters down there. And if you've ever gone down to Mexico, in those retirement communities, it seems like they're all Canadians.
Yeah, that doesn't surprise me. I'm just surprised about Phoenix.
So what do you what is the what else did you want to talk about? Now, there's so many things we could talk about with you.
Pick something.
Well, let's go back to you're trying to make these people successful, and you talk about patient-centered. We talked about being lifelong learners, but you said something very critical. And which came first, the chicken or the egg? Was it the type of person who's doing the CE? Was that why they're a better dentist, or did the CE actually make them dentist? What else do you think are you telling these kids will be deal breakers and forks in the road to make them be better dentists and over their long career?
My approach to teaching, and I'm not sure if this is going to be popular or not in the university, because it's a little bit different to the other ones. And if they kick me out eventually because I'm making too much trouble, that's fine. I have a very human approach to things. I think we're dealing with human beings, and we can't ignore that human part. Traditionally, being a professional has, you think of professional, you think of someone who's detached, whose emotions are in check. Everything that's not human, basically. And I'm trying to change that concept of what is a professional. So I don't mind, somebody wants to get angry, that's fine, get angry, but then apologize and say, sorry, I lost my nerves and it's okay. Show that vulnerability. So we have an issue as professionals to show vulnerability, and I think that's a bit of an issue. If we want to be more human, we need to show our vulnerable side. We need to show our human side, and I think the moment we show our human side, we'll be able to connect better with our patients, because our patients are human. They come to our offices. Obviously, they don't feel like they're top of the world. Something's wrong with them. A lot of them have, let's say, a broken tooth. They're worried. They're wearing their teeth. Maybe they're thinking about how they're getting old, the teeth don't look good. There's these thoughts inside their mind. They're not feeling like superhumans. And they go to this office and this dentist who acts like a superhuman with perfect everything. I'm thinking it's hard to connect this person. To be able to connect this person, I need to see someone who might be going through the same things that I'm going through as a patient. So I think as a step towards humanizing dentistry, it would be to start humanizing our concept of what a professional is. So we need to redefine this identity of what is a professional. So I think that would be one big step. We talk about patient-centered care. Yeah, patient-centered care is very important. But in the back of all this, it's humanizing. So it should be an experience where it's a very human experience to go get fixed by someone, healed, cured, or anything you want to call it. It's as human as it gets, yet we do it in a very sterile, non-human environment, in a non-human approach. And I wouldn't be surprised if that has contributed towards not doing as good as we could have done as a profession. I'm talking about dentistry, but it could extend to medicine also. Now, medicine is changing. Dentistry is not changing. Most dentists don't even know what patient-centered means. Most dentists haven't even thought about the things we do. For example, the things we do, the approaches that we have. You go into the office, what do you do? The first thing you do, you fill out a medical questionnaire. Why? Why is the first thing that you do is you fill up this completely non-human yes and no answer of what's wrong with you from a disease perspective? To me, that makes no sense. In fact, some of the experiments with it in my office with a colleague of mine from Toulouse, in France, we started giving the medical questionnaire in the middle of the appointment. So first the patient comes in, we say, hi, how are you doing? What's going on? And whatever, we have a little conversation. And then once that conversation was finished, then we did our exam, and then we asked the medical questionnaire. And boy, was it huge difference. Like the people started giving more information, the medical questionnaire was better filled, and it didn't become like a barrier to that rapport. So something as simple as placing the medical questionnaire at a different time in your appointment could make such a big impact. The problem is nobody's ever thought of these things. Nobody's thought of why are we doing the things the way we're doing them. I looked into all the medical literature and everything. There's nothing written on dental approaches. There's nothing that's been analyzed. There's nothing that's been thought about. Dentistry has never had a reflection on the sequence of things we do, the way we do it, the approach we have, nothing. It's zero. It's uncharted territory. So that's got me excited about doing, that's why I started doing a master's. And I wanted to look into this. It's interesting. I find it's interesting. It's weird that the 100-year profession has never been reflective on its own approaches.
So, Nareg, I'm a new patient. I just walk into your dental office. What do you think the sequence should be? I just walked in your office. Is this Dr. Nareg's office? Am I in the right place? What would be the sequence be?
Yeah, so I'll be like, hi, how are you? Like, I'm fine. And I usually would ask them, so how come you're here?
Because you're bald.
Perfect. It's the Bald People Association.
I only deal with other bald people because I know our brains are so big that it killed all the hair roots, and that's why we're bald.
Humans evolved when they stood up, and they stood up because their heads started getting hotter, so more blood went to their heads, and that's why the brain got better, and this whole like Homo sapien thing. So I think being bald is the next step in that evolution where you lose your hair, more sun goes in, more blood goes to the brain, and the brain gets even more developed. So anyway, that's my little...
Well, my thoughts are, you know how the people who go bald from the front are thinkers, and the people who go bald from the back first are lovers, and the people who go bald like me, front and back, we just think we're lovers.
Oh, nice one. So the back of my head.
So how? So what would be your perfect sequence to make it more humanitarian, more anthropology, more socialistic, more more human?
Not socialistic, not humanitarian, but more human. This is not about helping the poor. I mean, yeah, it works well with poorer populations, but I think it would work with everyone. I think people go see their medical practitioners, whether dental or medical, to talk about their health. So that's what we do. So you come in, you sit in the bar, and like, why are you here? How come you decided to go see the dentist? Well, they will say, I'm kind of worried something happened here. Okay, then that starts a conversation. So we talk about that. We explore everything that needs to do about their health and whatever they think about their health, how they feel about their health. You said you lost a tooth. How does that feel to lose a tooth? It must feel, do you feel getting older? Does that bother you? I'm not afraid of going into that and then exploring all facets of anything that has to do with dental health or oral health. Once all that conversation is done, it comes to a finish, then we can go over the medical questionnaires and do the whole yes/no answer. Why do I ask and delve into the feelings and everything? I don't necessarily delve into the feelings all the time, but if I see somebody needs to talk about it, I let them talk about it. So that's why I can't recipe book the approach, but I can have I can say that the idea behind it, the philosophy behind it, is to let the person express themselves. So if you see someone really is anxious, they have something to talk about, as healthcare professional, I need to be sensitive enough to that to be able to make them talk about it and not be an ass enough to cut them and then say no, that's stupid. We don't, I don't impose my medical models onto them. So I think what we're teaching the dental students, hopefully, is to listen to patients, even if they have absurd ideas. Let them try to understand them. It's all about understanding the other person. Does that help? I know I went.
Yeah, no. I could listen to you all day, dude. I love your posts. I always love reading your posts. I love everything about you. But you know what? I actually, they say history repeats itself. I don't think anything's ever changed since the original medicine man. I mean, go back 10,000 years. I mean, you go to a witch doctor and he's all these lotions and potions, which is now Walgreens and your local pharmacist, or they take out a knife and they cut some body part out, and it's lotions and potions and magic and voodoo. I mean, and then my two older sisters went into the Catholic nunnery straight out of high school, and so our family was crazy Catholic. I mean, we had to go to mass every single day. We had to say the rosary every single night. And my favorite priest was Martin Luther, because he knew that's what the priests were doing 500 years ago. It was all voodoo, and then because the Germans couldn't read the Latin Bible. So he was the first Catholic priest to translate the Bible into common German so the common people could read it. And here 500 years later, you still hear dentists talking, well, you have irreversible pulpitis and you'll need endodontic therapy and you'll need a mucoocclusal restoration. Do you have any questions? It's like, what was that? Latin, Greek? What the hell's all that about? And then if you talk English, they're too arrogant. I want to go to this. I want to ask you this question. I'll let you do the dentist, but I routinely ask people, I say, well, what descriptive words come to mind when I say lawyer? And they're almost always say arrogant, prick, liar, same with politician. And what do you think? And when I say, well, what about your physician, your MD? They still say, well, arrogant, know-it-all, talk down, condescending. We saw the death of the male gynecologist because the women didn't feel, well, how do you even know what's going on? You've never had a baby, you never had a period. I mean, don't tell me it's all in my head. You know what I mean? What words do you think Canadians use to describe, if you said describe a dentist, what do you think would be the first 5 words that come out of their mouth?
What would I like it to be, or what it actually is?
What it actually is.
I wouldn't be surprised if they say crook at some point somewhere in that list. I think there's a distrust of dentists that's been growing more and more and more. I would like them to say they're very, very human. I would like them to say that. Oh, he's my buddy, my dentist. But I don't think they say that. And I don't think I would be able to come up with 5 words, to be honest.
Now you're hearing lion killer. Did you remember that?
The lion killer, yeah.
The Cecil the lion killer. Somebody in the swimming pool told me that. But anyway, yeah. So,
what do you think will be the 5 words?
Well, I think this. I think about this all the time. And right now, if you go on to Dental Town, when I got out of school, the big boogeyman was first it was OSHA. Dentists thought they were all going to go to jail for an OSHA violation, and then later it was HIPAA, and then back in the day in '87, it was this capitation where instead of paying you money per procedure. They were just going to give you like $10 a month, and you just fix up the patient and all this stuff. And so I've lived through 28 years of different boogeymans and monsters that are supposedly always living under the bed, and they're always going to come out in the middle of the night and get you, and they never do, and nothing ever changes. But right now the big one is corporate dentistry. Okay. And I think it's laughable because at 28 years of practice, I mean, I can't find anybody who stays at their same dentist. I know the lady I swam 2.5 miles with this morning. We did the 4,000 meter, 159 laps or whatever. She's been to 3 different dentists this year, getting different opinions and this. I mean, she's gone to 3 in 1 year. So the corporate dental chain, a lot of these corporate dental chains, they can't even keep their dentist employees for 1 year. Their average dentist doesn't even work them for the year.
They have a high turnaround, yeah.
Yeah, and the patients are just revolving door. And you could also explain this in capacity. So if a hygienist works 40 hours a week, 50 weeks a year, that's 2,000 hours a year. So she could clean 1,000 Howard and Naregs twice a year. She could clean 1,000 people twice a year. So you go to a dental office 30 years ago, how many hygienists you got? 1. 10 years later, how many hygienists got? 1. 20 years later, how many hygienists got? 1. They've never changed their capacity. And then you say, well, how many new patients do you get a month? They say 25. You say, okay, well, every 33 months you should have added another hygienist. So nobody
losing at the same time, yeah.
So the corporations can't keep a dentist, and this is why when I got out of school, Orthodontic Centers of America was on the New York Stock Exchange. It was $1 billion valuation, and the whole thing collapsed and everything because they couldn't keep their orthodontist. There were a dozen on NASDAQ. So now then they all collapsed. They disappeared for 10 years. Now they're back. Same red flags. They can't keep their dentist. And as far as not keeping their patients, it's not just corporate. It's everybody. I don't see anybody's capacity. I don't see practices that are getting 25 new patients a month, growing 1/3 every year, on and on and on. They're always the same size. 20 years later, they're the same size. 30 years later, they're the same size. So nobody can keep a patient happy. And what you're talking about, what my big beef is, what you're talking about is whenever you start talking about this subject, that's fluff. I want to learn about bone grafting. Shut up, Nareg. Teach me. Do I need bone morphological protein? Do you like autogenous graft? They want it. They want to
Which
talk
is important.
Yeah,
which is very important.
It is important, but they want to be engineers. They don't want to talk to people. They don't want to talk to people. They don't want to relate to people. They don't want to relate to their staff.
Well, there's talks that maybe dentistry should split into 2, and part of it should merge into medicine, and the other part should become a technique. These are ideas that are being thrown around at university levels, I guess, to see, what is dentistry? Are we doctors? Or are we technicians? And I'm not sure we have a clear identity on this, because we like to call ourselves doctors, but we act like technicians. So, we need to come to a conclusion on this. As a profession, we need to sit down and say, okay, we are doctors. Okay, if we are doctors, then we better start acting this way. Or if we're technicians, then we need to act this way. Or if we're a bit of both, then we need to figure out exactly where that line stands. And right now, I think there's a bit of confusion when it comes to dentistry, a self-identity. Because if you ask most dentists, I think they see themselves as technicians. I mean, most dentists are proud. Look how nice my prep is. Look how nice my filling is. And we barely mention about, look how happy she became after seeing me, type of thing. Or how well her life was improved. We don't see those posts.
I think the best education is going around the world. When people have debates about healthcare models, everybody has an opinion and they've never gone to another country. But when you study the 206 countries around the world, 190, I'm at the 180 at the United Nations, you can see, the differences in healthcare systems and all that stuff. And I think that the Soviet Union did it better, where their dentists were a stomatology. All the medical students, 4 years undergrad and the reason why it has to go back that way. It's separated in Baltimore in about 1890, and it was separated by architects. Because the dentist needed a sit-up chair and the physicians needed a lay-down bed. And because of a stand-up, sit-up chair and a lay-down bed, that's how we got separated. But the Soviets left them in place, so the 4-year med school is the same, the 2 first years of med school, and then you do a rotation. It could be in dermatology or gynecology or stomatology. And the reason I think that is so critical, not just all the oral health systemic links and all that stuff, But the deal is, physicians, 90% of them don't have to work with their hands. They don't have to do surgery. And if you're a cardiovascular surgeon and you're losing your eye-hand coordination, or you're just not good with your hands, you can just be a cardiologist. And I think that dentists would be a lot happier and a lot less stressful is if they started losing their eye-hand coordination, or they weren't good with their hands. They could say, you know what? I can just go back to med school and I'm going to do a rotation in dermatology or ophthalmology. I'm going to do something non-surgical where I just use my brain and not my hands. And I think it's one of the biggest curses in dentistry that you force these people that always have to work with your hands. And my analogy to that is, I mean, how many times have you seen where this person goes to school and gets a degree in painting, and then you meet your 12-year-old niece with no training and she's a better painter? I mean, at the end of the day, there is natural ability. Some people have gifted hands in painting. I mean, and look at singing. I mean, I had 4 boys, and I used to think that singing was cultural preference, right? And I'd be rocking my little 1-year-old baby, and I'd be singing, and they'd reach their hand up, put on my mouth, and say, "Daddy, no." And I think, oh my God, a 1-year-old knows I suck. How does a 1-year-old know I can't sing? I thought I could fool this guy. So there is natural ability in singing and hands and artists and painting, and the medical model of stomatology, like the Russians do, would be far better.
Well, maybe, it's something that could be considered. More and more schools are trying to annex their beginning years with medicine. In Canada, that's popular. We have at least two schools, maybe 3 schools. McGill is one of them, where the first 2 years is with medicine. So they do 2 years of med. And then once they finish doing 2 years of med, then they go into dentistry and they continue like the dental part of it. Except it's so crammed, the 2 years of dentistry, that it becomes difficult on a curricular level. So maybe should we add another year? I don't know. Those are all questions that they need to figure out. But at the more essence level, we need an identity, and we don't have that identity. In my opinion, we don't have that identity. There's no clear identity of what is a dentist.
I know the main identity dentists have. I think most of them believe they're rock stars, because I look at their living expenses. I mean, I know a dentist that was going bankrupt and he had 5 cars. And I mean, like, are you the lead singer for the Rolling Stones? How the hell did you think you should have in dental school? They're taking cruises, they're going to the Caribbean, they're world travelers. It's like, dude, are you a rock star? Do you have an album I didn't hear or I missed? Their overhead is that I think they think they're rock stars. I mean, it's amazing. I mean, I'm 53 years old and my car is a 2004 with 115,000 miles. Then you drive either way to these 2 dental schools, and half those kids, new cars, $30,000, they only got 12,000 miles. Like, why does your car have 12,000 miles and you have 5-year payments, and mine has 115,000 miles? So yeah, I think their identity is rock stars, but I have to stop that.
You are a rock star, Howard.
What's that?
You are a rock star.
No, I'm only a legend in my own mind.
Oh, okay.
I'm only a rock star in my own mind. Hey, I wanted to ask you another question since you're trilingual. You said you had a colleague in France.
Yeah.
And France has is part of the EU, and is their official language English in Brussels?
The official language of France is French.
No, the Brussels for the EU, or European Union. What do they do all their legal work in? Do they?
What language they do it in? I have no idea.
Because I was wondering, when you talk to your colleague in France, do you speak in French, or do you guys?
I speak in French. Yeah. He barely speaks. I mean, he speaks English, but he struggles with it. I don't struggle with French that much, so we communicate in French.
So do you ever get on there's a French dental town called Eugenol. Have you ever got on that?
He goes on that.
Yeah.
I haven't, but he's shown me excerpts of Eugenol. Yeah.
That lady is so cool. When I was I started Dental Town in '98, and she started Eugenol years later. Okay. But when she started Eugenol, I was so proud of her. She flew all the way from Paris, France, to Phoenix to talk to our team about ideas and.
Oh, really? Wow.
Oh, and I just thought
contact. Cool.
I just thought, I was so humbled that she was so ambitious that she would fly all the way from Paris to Phoenix to talk to little old me and our team at Dental Town and everything. Just the sweetest lady in the world. And I haven't seen her since. So I was wondering if that's all going. So we were talking about, you want these people to be successful, and you were talking about patient-centered, and we talked about you talked about vulnerability. I always talk about parroting what Harvard Business Review is always saying, and they're always saying that the number one trait they see in the most successful CEOs is humility,
Hmm.
humbleness, humble humility.
Yeah, humility. Yeah.
What else do you think they need?
Well, you know what? We came up with like a model of what does it mean to be patient centered. Our model says there's two sides. So when to understand everything, you need a model, which is a higher level, and you need an approach, which is more of the recipe thing. So our model, we said that in order to be patient centered in dentistry, before that even, we said dentistry goes through three things that are different from medicine. So we try to understand, we take a decision, and then we intervene. And that intervention is different from medicine. In order to understand, to be patient-centered, we need to understand not only disease, but we also need to understand illness. So disease is the actual disease, and illness is the experience of the patient of that disease or of anything. So illness is an experience thing. And we usually don't explore illness the way we explore disease. We're very good at exploring disease, we're just not very good at exploring illness. So adding exploring illness would be important to become patient-centered. When we're doing decisions, so when there's decision making, to be patient-centered, the decision-making has to be shared. So it needs to be a shared decision-making. It's not you decide as a patient, it's not me that I decide as a dentist, but we decide together what would be best for you. In order to do this, we need to let go of the idea that there's an ideal treatment plan and everything else is a compromise, because then we're not doing a shared decision. To do a shared decision, we need to understand that there's multiple ways of doing things, and we need to figure out together what you need and what I can do for you, and then let's put those two things together and then figure out what's the best for you. And what's the best for you could be very different from what's the best for somebody else presenting the same situation. And finally, in interventions, we said that in order to be patient-centered in interventions, we need to go at the pace of the patient, and we need to include the patient and their expectations into our outcome. So it's not just about getting that x-ray that looks perfect. It's all about, how do you feel? Are we comfortable now? And that is as important as that x-ray that looks like that white line is all the way to the tip of the apex. Who cares? But we care, right? This is the model we came up with. And then as an approach, we said that for a dentist to be able to do this, they need three characteristics. Humility was one of them. Hospitality is another one. Because you can be humble as you want. You can open the door, but it's not enough to open the door. You need to invite people in. You need to attract the attention, attract the questions. You need to say, ask the questions. You know, your whole demeanor has to be very welcoming, and that's very important. I think that hospitality. And finally, we said we need to be mindful. Mindfulness is like the new buzzword in medicine now. Mindfulness is the ability to be present. So when I'm talking to you, I need to be mentally present. We need to make contact. We need to connect. I shouldn't be like writing something and washing my hands, and then while you're explaining to me your life story, that's not being mindful. Mindfulness is in the moment, right there, like we're connecting. When we're working, we need to be mentally present while we're working, not chit-chatting with our assistant about how the weekend was while I'm doing some kind of a work. That's not being patient-centered. It's a little bit insulting for the patient. So those are the three attributes we said that the dentist needs to have. And then how they do it, it's up to them, because we cannot say one way fits everyone. But as long as you have these attributes, each dentist, based on their personality, on the patient's personality, they're going to have different recipe books of doing things. And that's fine. Like there's I don't think one way needs to be, you can't just tailor one thing and then apply it on everyone. So if you like big words, the big word for this is constructivist. So this is a very constructivist way of looking at things. That means reality is constructed by different people's construction of reality, as opposed to a positivist view of health. A positivist view says, this is the right way, this is the wrong way, and we can clearly measure what's right, what's wrong. And that used to be the old way of doing things, the positivist view, but more and more the tendency is going towards a constructivist understanding of health. So what does it mean to be healthy? It's different for you, it's different for me. I might have a different idea of what it means to be healthy. Don't impose your values of health on me when I have completely different values of health. Maybe for me, aesthetics is more important than an infection in the back tooth. I don't know. It's my health, it's my body. So that needs to be taken into account. Sure, there's some limits we can't cross, legally mostly, but I think we need to at least acknowledge that the construction of each person does of health is important. There, I'm done.
All right, I swear to God, I'm going to start calling you the Socrates, Plato, Aristotle of dentistry. If you and I know this is 10 times more important than which implant system to buy, Why don't you build an online CE course on Dental Town on this, the patient-centered practice, and cover all of this because they need it more than anything. They come out with $250,000 student loans, and they think they can't be successful unless they spend $150,000 on a CAD cam, $75,000 on a laser, and $100,000 on a CBCT 3D X-ray machine. And I can give you the names of 100 massively successful dentists just because they don't have any of those things, but they're just humble and have humility and mindfulness and vulnerability and you know what I mean? Why don't you do that?
I thought a while ago, I discussed it with Howard. I thought there would be no interest back then. I don't think people are interested. If they're interested, I'll be more than willing of putting together some kind
They
of.
will be very interested, and I think it would be far better if when you presented it, it was for the team. You know that the office watched this in the patient waiting room, and they put Nareg up there on the screen and get in the zone together. You know what I mean? Because they're not laboratory techs. You know, they're not. I mean, when they come in, it's just that everything you're talking about is the most important. And then when I talk to my peeps, they're like, "Oh, that's fluff." You know, I want to talk about which bonding agent to use. I'm like, who cares? Who cares? It doesn't even matter.
Those might be more interesting for dentists, but if dentists are interested or teams are interested in anything like that, I'm more than happy. I have like tons of courses I've already done here at the university. It's easy to turn this into like an online CE thing. It's not that difficult.
Yeah, let's do that. You might even do a series. And I read something very interesting on mindfulness that with one technique, you massively raise the score of the patient thinking that you were listening if you just repeated something before you go to the next question. Like if I ask you a question, you answer, and I'm a doctor, we have reading comprehension, we got it. We go to the next question. They don't think you're listening. But if you just kind of paraphrase, summarize it with a few words, then go to your new question, they're like, he's listening.
He understood it, yeah.
Yeah, so you got to repeat.
I'm not a huge fan of those recipes per se. They're great. However, the intent has to be behind it. And I'm scared some people who don't have the intent, they just repeat it like automatically. And I think patients can tune into that. Some patients can tune into that. Like I can tell when you're just repeating what I'm saying just because you repeat what I say, as opposed to you actually, you're there in the conversation.
Nareg, the secret.
Mindfulness.
The secret to success is to be able to fake sincerity.
And that's right.
That was a joke. That was a joke. No hate mail.
Yes.
And I also you kind of sit in the middle of France and English England Canada. Is everything you're talking about different in Paris than it is Toronto or Detroit or Chicago? Have you sensed any of that?
Same level, the universities around the world, I think, are at the same level. At least France are. However, there seems to be they're faster to change. So
who's faster to change?
Their patient-centered techniques are being implemented with much less resistance in France as we're having here in Canada. So people seem to be a bit more resistant here. Maybe it's the way the universities are. Maybe we're much more conservative. Maybe they're less conservative in France. So they're like, yeah, let's change, no problem. Like they're more risk takers when it comes to teaching students, approaches of teaching students. Maybe that's what it is. I don't know. But my colleague is having a much easier time implementing patient-centered techniques in Université de Toulouse, Paul Sabatier, than we are here.
Is Paris one of your favorite vacation spots?
I've never been to Paris.
Oh, you're kidding me. You speak French, you've never been to Paris? I might have to fly you there myself.
I went to Toulouse. South of France was one of the beautifulest places in the world. I highly recommend. You can buy amazing wines for €2, €3 straight from the manufacturer. Amazing cheese, amazing food, beautiful scenery. It's south of France is a paradise.
How politically incorrect can I get summing up Paris? How many people can I offend?
You can't offend French.
Okay, I'll tell you the truth about Paris. They are far more serious about their food, the way they look, the way they dress, the way they smell. I mean, you go to Britain and Germany and you meet a 60-year-old man or woman and they don't really care how they dress. Their food is bland. They have no cologne or perfume. And I mean, a French woman at 70 is still rocking it.
Yeah.
I
Yeah.
mean, she's sitting there with her purse, her shoes, and there's garnishes on them. I mean, I think I think it probably is the most cultural town in the world.
Yeah, France is weird. On one hand, they're very liberal. On the other hand, they're so stuck on their rituals, their social rituals. You know, they in France you have tu and vous, like it's the plural you and the singular you, and then out of respect you call people who you haven't met before or you don't know them well as the plural you. Like in today's age, this is all gone. But in France, you have to stick to this. It's like a huge deal for them. I mean, for a society that's so liberal, it's weird how they have all those social etiquettes that are so stuck. So the way you're saying, the way they look, but their food, the rituals of eating, pairing wines with the food, you know, it's so ritualized, and they're very stuck on those, which is weird, you know, because they're so
Maybe that's why now it makes sense because they keep asking me if I was born in a barn. So now it's all maybe you're summing up. Maybe I was doing something wrong. Hey, I got to ask you a last question. Since you
Yeah.
speak French, the father of dentistry is Pierre Fichard. Did you ever read his book? I think it was
I
written
haven't
in
read his book, no.
1780 or whatever or whatever.
I have not read his book.
Well, you know
No.
what? We're having Dental Town. We started in '98, and then in 2004 we had online CE, and then we've added a podcast. But the next feature coming out is audiobooks.
Okay.
And I'm gonna read that book and I'm gonna try to find someone in French to read it. So if you could, I know you're a busy man, but if you can find me a French dentist, because I'm gonna have the audiobook. I'm gonna have the Pierre Fichard's book in French and then English, and then I'm also gonna do the Americans' father of dentistry, G.V. Black, which is about 100 years later than Pierre Fichard, and do that in English.
Oh, that's a cool project. I
So
can try and find someone.
you can find someone
I'll
French.
keep you in mind. No worries.
Yeah, find it because they'll have to know dental terminology, I assume. You know, but hey, Nareg, seriously, dude, this was the most fun hour I've had all week. I'm your hugest fan. You're just a great guy. You shared so much, and I just think you're a great guy. Thank you so much for spending an hour with me today.
Thank you. Thank you. It's my pleasure.
And anytime you want my free services in Montreal, dude, I'm there for your countless gazillion hours you spent on Dental Town.
Thank you so much.
Bye bye.
Bye bye.